Over the past several years, the HIV/AIDS epidemic has changed. More people are living full productive lives with proper medical care and support. Fewer individuals are progressing from an HIV to an AIDS diagnosis, and we as an organization need to keep pace with those changes, and we need to reflect the current state of the epidemic. So therefore, we decided to rebrand as Palmetto Community Care. We'll continue to offer the same excellence in support and services to people living with HIV and AIDS in the Tri-County. But to be able to sit in a room with someone and carry on a conversation of why you're looking to change, because the epidemic does change, it evolves. And of course, as an organization, we have to evolve and we have to change with it. You know, not only are we referring individuals out into medical care, but we offer an array of services: housing support, nutritional support, emotional support. We also help individuals overcome barriers to care, and that could be substance abuse or emotional support. So working with them to help them overcome those barriers and get them into medical care, because our ultimate goal, of course, is viral suppression and keeping people in medical care.
Stigma is a big issue, and the word AIDS has a lot of stigma for many people and many of the people that we work with. So changing the name is one small effort that we can do that has large results to reduce that stigma. As we grow our services, we've expanded what we do for our clients and for the community year over year for the 25 years. And this is part of our evolution. We still need the community support to provide the high level of care programs and services that we've always provided.
HIV/AIDS is still here. It's still important in everyone's life. It hasn't gone away. It's still an epidemic, but you just don't hear about it. But we as a community, we need to support each other because we need each other. This agency, we offer a lot. Everything is confidential.
I think the perception in the greater community is that the HIV/AIDS epidemic is through. It's not killing people. People aren't seeing the images they saw in the 80s and 90s where people were going to hospice and maybe only living a few years, a time when the medication was almost as bad as the disease. Now we have medical advances and people are living longer. But unfortunately, access to that health care and that life-saving medication is not spread equally in our community. What we do is we help those people who need the help the most, who need medical coverage, who need access, who don't have stable housing. We look at the whole depth and breadth of what their life is, and we choose those areas where we can help the most, where we can stabilize them, get them on a path to being medically compliant and taking care of their health, and then living a longer, healthier life. Palmetto Community Care focuses on many areas on how to promote awareness for the HIV/AIDS epidemic. From our fundraising events to our social media presence, blog posts, we try to get throughout the community and reach different segments of our community with messaging that helps them to get testing, to come in and get services if they are HIV positive. And it's just a reminder to the community that the epidemic has not gone away, that it's something very serious, and that without help, without the medications, without medical care, it still can be very damaging to someone's life. And we want to help them through that, help them live longer, healthier lives.
So at Palmetto Community Care, we cover the Tri-County area of Charleston, Berkeley, and Dorchester County, which is actually 2,600 square miles. And what we found is that a lot of the folks that are in some of the most high needs and rural areas in our community don't have access to transportation, and they can't make their way to our offices to access these services. And so our idea then was, if you can't access our services because of transportation, we'll come to you. And so that's really the big push with the mobile testing van, is to work our way into those communities. We know, statistically speaking, in the South we have higher rates of HIV in rural and suburban areas than anywhere else in the country. And so we know that there are folks who need our services right now who can't access them. And so we're going to use that van and some of the mapping data that we have to get out into those areas and make our services available to folks who traditionally could not access them. While we know it may be scary to come in and get an HIV test and go through this process, at Palmetto Community Care we have all of the resources that you need regardless of your status. So if you're HIV negative, we have resources that we can connect you with. And then as well, if you do test positive with us, We are a one-stop shop for all of your needs. Everything that you need moving forward after a positive diagnosis, you'll find here.
That I was diagnosed in 1991, and it was early in the years with HIV/AIDS. I didn't know what to do. I didn't know who to turn to because the stigma was so high, especially in the Black community. I didn't tell anyone. I was afraid. Young mother of 2 young children. When I came to the agency, they helped me with various things like light bill, clothing, food, and it helped me. It took away a lot of screen, which way to turn, because I was afraid, I was afraid I was going to be shunned against from the community. So I kept it all inside.
At Palmetto Community Care, we recognize that there is an epidemic still happening in the South, and specifically here in South Carolina. And so we really wanted to make sure that we are reaching the populations of people who need this testing, and also reaching the population of people who maybe haven't been able to access our services in the past. And so we've done a lot lately through social media and our social media channels, outreaching to folks, and then we're also trying to increase our presence within the community by making ourselves available for community health fairs, for community organizations. We work with faith-based organizations, community centers, community health centers, anything that we can do to try to get the word out about what's happening here in South Carolina, and then also what people can do and what services are available to them.
What gets me going, in all honesty, is the passion and commitment that my team has. To see the work that they do every day and the commitment they have to this cause. A young boy, 18 years old, who walked here from high school to be tested, and he tested positive. He was estranged from his family and was still helping to support his mother, working after school to support his mother. So he was just so impacted by this and thinking that this was the end for him, with the toll that it had taken. And as we got him into counseling and working with our case management team and realizing that it wasn't the end, we wanted to bring some normalcy into his life. In doing that, we were able to help send him to prom and purchase or rented a tuxedo, and of course paying prom fees, so to bring back some normalcy to him.
And even if I wasn't paid for it, I would still be here regardless, because I love the agency, I love helping people, and it's for a great cause.
I've been with the agency for 18 years. I've been very fortunate to be the executive director for 14 years. I'm very committed to this cause. Losing my brother to this epidemic back in the early 90s, we saw what it was like in those days, of course, people suffering and dying from this. So I am grateful and fortunate for the work that we do, and I'm very excited about this change and this rebranding.